Well, good evening, everybody, and thank you for joining us tonight for this webinar on succession planning for general practice and allied health. I'm Sandy Vincent from the PHN Education team, and I'm joined tonight by my colleague Amy Clyde-Smith, who has coordinated the session, and our two wonderful presenters, Russell Lee, who's the founding director of the Health Business Network and Docio Health, who'll be speaking on succession planning with a focus on the rural setting, and Jason Borody, Director of Vividus Marketing and Co-founder Director of Docio Health. Before we begin, I would like to acknowledge the traditional custodians of the land on which we all work and live. For me, that is Darkinjung land, and pay respects to elders past, present, and emerging. I've got a couple of things I need to let you know. This session is being recorded, and the recording will be available on the PHN Education Library in a couple of days' time. At the moment, as attendees, your cameras and microphones are automatically disabled. If you do have questions during the presentation, please send those through the questions box, which you'll find in your control panel. If you can't see that control panel at the moment, you might need to click on a little orange arrow that will open that up, and then you'll be able to see the questions tab where you can type your questions. We've got time at the end for us to address those with you. An evaluation will come to you directly after the session. Please do complete it, as your feedback is very important to us. It's now my great pleasure to introduce our speakers to you. Jason Borody is a business consultant and marketing manager with over 26 years of commercial and leadership experience. Jason has a Bachelor of Business majoring in finance and marketing and a broad range of experience both in Europe and Australia, specializing in business development and strategic marketing for medical businesses. He's worked with brands like Medtronic, Private Practice, MedTech Global, as well as hospitals, practices, and colleges. Russell Lee is a clinician, business consultant, educator, and facilitator who has guided hundreds of doctors and medical practices to profitability and through to successful sale of medical practices. Russell and his national team at Health Business Network design agile business solutions for healthcare providers of all sizes. Russell also co-founded Open Heart International, which has provided thousands of life-saving surgeries in 13 countries. And in 2012, he was awarded the Order of Australia for distinguished service to the international community and his expertise in establishing a clinical outreach service that provides insight into successful and scalable medical and allied health operations. So you're in very good hands tonight, folks. With that, I would actually ask Jason to please start your presentation.
Well, I'd really like to thank Sandy and Amy for inviting us to present to you all tonight. This slide that's up there at the moment is a general disclaimer. I think that the information we will give you or share with you tonight has the best intent. However, we always have to remember that when we're doing something, we need to have specific advice for our own practices. So just a reminder on that. Sandy has been very kind and shared about us. So we'll get straight into the discussion, and we're going to start off by presenting some information to you, and then later talking and trying to tease it out a little bit more and answering some of the questions. And when we're talking about succession planning, probably the first thing is who buys into healthcare practices and why. And the typical buyers, if we look historically, come from inside a practice. So a doctor that's working in a practice might buy it off an owner who's retiring, or we've got external doctors that are developing businesses and they buy multiple sites. Then we've got young doctors that are starting out and looking to set up their business. And then, obviously established doctors that are wanting to grow larger businesses. In the last probably 5 years, there's some groups that we call aggregators that get health providers from all around the country, and they buy a share in the businesses and have, you know, in one particular case that I am aware of, they have 57% of ophthalmology on the east coast of Australia. And so the doctors who own it still maintain a share in it with an opportunity to sell out at a future time. But